And joining me now is the mayor of Billings, Montana, Bill Cole. Mayor Cole, thank you so much for being here with us this morning. We just saw some of those heartbreaking stories out of a hospital in your city. You heard Matt Gutman mention some hospitals are functioning at 200% capacity. What is your biggest concern right now?
Well, it is the capacity of our hospital. We have two the largest hospitals in Montana, made up of a lot of superheroes, as Matt's story shows. And that's our greatest concern is, will they be able to keep up with demand? The good news here is that they're dealing with a surge that really hit us right before Thanksgiving. And so they're seeing the most difficult times. But the good news is our numbers over the last 2 weeks have actually declined. So we're hoping that they're going to get some relief. They've been able to improve that capacity, as you reported, by taking their pre-COVID capacity and just adding more rooms, putting 2 people in a room, and working very, very hard.
So I guess my question is, what help do you need right now there in Billings? What would make a difference for you guys right now?
Well, of course, behavior. We were very lucky. We were in a dark place until our numbers started to come down. But we got, we were, I think, a little cocky through the spring and the summer. We had it very easy, and that made it too easy. So when the surge hit us, it took us a while to have those kind of personal experiences that change people's behavior. Now, everybody knows somebody who's been hospitalized or who has died of COVID-19. I have a Native American friend who told me the other day that he's had 4 aunts and uncles succumb to the disease. And that is changing behavior. So that's top of the list. But then we also need to roll out our vaccine and prepare for the vaccine. We got news from our governor yesterday that we'll have 9,750 delivered next week, assuming the Pfizer vaccine is approved, and we're making plans to roll that out efficiently.
I'm curious what you're telling residents to do to stop the spread right now, especially because we are in the middle of this holiday season and Hanukkah and Christmas are just around the corner.
Yeah, well, it is to wear that mask and social distance, wash the hands, all the things that have been repeated around the country and around the world. As I said, it's starting to make some difference. After we're now 12 days out from Thanksgiving, and we're yet to see a significant surge from Thanksgiving. Now, we're not out of the woods yet. We've still got a few days left, but we've got our fingers crossed. We are concerned that people might become complacent again, and going into colder weather and Christmas season, we do not, this is not the time for complacency. We have to double down with all those protections.
Montana's had a mask mandate for months now, but the cases, as you mentioned, are still high. You also kind of made reference to the fact that people have gotten a little cocky because you guys fared pretty well through the surges in the spring and the summer. Are people now following that mandate and social distancing? And what kind of impact have you seen since that mandate was put in place?
They are much better than they were before. Again, I think one of the sad things about this disease is you have to see it firsthand for it to really strike home. It is a delicate balancing of risk at every stage. First and foremost, for our lives and our health, but also to livelihoods and our economy. So people have gotten better, but we can still do better.
You mentioned this. A vaccine is coming. All eyes have been waiting and watching for this. The Montana Public Health Department, as you said, is expecting more than 9,700 Pfizer vaccines by December 15th. But there's a lot of skepticism out there about the vaccine. Do you have a sense of if your residents will actually take the vaccine? Do they trust it works and its safety? And kind of how are you guys preparing for all of that?
I am not hearing concerns about the vaccine itself. I think our problem will be a lack of supply, not a lack of demand. 9,700 doses will not go very far. We will prioritize first healthcare workers in the trenches, and also residents of long-term care facilities. But that's just not enough doses. We are the largest city in Montana and the largest city within 500 miles. And we have to care not just for our own residents, but those hospitals are full of people from northern Wyoming, all over Montana and the western Dakotas. So at any given time, our hospitals have about 50% residents and about 50% from outside of our county. And that means we need to get the vaccine out. One of the things we're working on is how to make them available at multiple locations. We may open up our fire stations, for example, and use paramedics, pharmacies, of course, the health clinics. We just hope that there's enough vaccines left for Montana. Sometimes we're at the end of the road, and it doesn't seem like we get all the support that we need. That was certainly the case with testing. We just haven't had enough testing kits to do surveillance testing, and that's hurt our ability to do contact tracing and tamp down on the spread of the disease.
And that is something that a lot of states and rural areas are seeing, that same issue. Mayor Bill Cole, thank you so much for being with us. We really appreciate you this morning.
Eva, it's great to be with you, and stay safe.
You as well.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.